Hi, I'm Meg Callahan with Infectious Disease Special Edition, and I'm here with Ryan Maves, who's a professor at Wake Forest University, and Critical Care Congress is here. You're on the program committee. What are you excited about?
Yeah, well, thank you so much, first of all, for having me. Yeah, so Critical Care Congress is the annual meeting of the Society of Critical Care Medicine. I have the privilege of being one of the three co-chairs for the meeting, along with my two co-chairs, Dr. Ndidi Busa from the University of Washington and Dr. Lama Nazer from King Jordan Cancer Center in Amman, Jordan. And so this is our kind of major event of the year, one of the bigger scientific meetings in critical care medicine. And so, there are a lot of things that I'm personally excited about. Probably one of the highlights is we'll be releasing the 2026 updated version of the Surviving Sepsis Campaign international guidelines for the care of patients with sepsis, both the adult version and the pediatric version. And so those are going to be presented there, and that's very exciting. There's also a number of other consensus statements and guidelines that are being released. These are generally done in part, a lot of these are done in partnership with our colleagues in Europe with the European Society of Intensive Care Medicine, both the Surviving Sepsis guidelines and a number of others, definitions of refractory septic shock and the like. And so to that, I think the thing that we all really enjoy, especially after the pandemic, is a chance to meet and see, both meet new colleagues and friends and to see our old colleagues and friends and, just share stories and talk about our work and talk about our lives and have a chance to learn something new. It's been a lot of work to put the sessions together with both with the SCCM staff and my co-chairs and the rest of our program committee. And there are some great sessions on really the full spectrum of care of the critical care patient, from children to adults to the very elderly. We actually have a track specifically on care of the aging adult in the ICU, which is very exciting and something we're doing for kind of the first time. We're also going to be having a lot of sessions. We're actually going to have a dedicated pediatric critical care track this year, which is going to, I think, both support our pediatric critical care colleagues by making it easier for them to find sessions focused on their clinical and educational needs. We have a lot of pre-courses every year. Our ultrasound courses always sell out and are always a big hit. And I actually just came back from checking it out and visiting with the faculty there, and they're going strong. There's a great advanced airway course going on, and then a lot of courses related to growing as a leader in critical care, developing both management and leadership skills, which are not necessarily the same thing, to help people advance in their careers. And then, of course, just a lot of great new science, a lot of great submitted abstracts that we're really looking forward to hearing from, including a number of late breakers from both the SCCM journals, which are Critical Care Medicine, Critical Care Explorations, and Pediatric Critical Care Medicine, as well as late breakers from JAMA, from Lancet, the Lancet Group, and from New England Journal. So very excited about all of that.
Very exciting. Dr. Ryan Maves, thank you so much for talking to us.
Thank you for having me. I really appreciate it.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.